So collaboration between academic institutions and PAHO towards the Eliminate Initiative, I think there are several ways that this can be explored and accelerated. I think the WHO collaborating centers and existing networks like the Canadian Network for NTDs, for example, those groups and networks that already exist, I think are really important to activate those and for PAHO to make those connections between the needs that are coming out of the member states towards reaching the elimination goals and sharing those with academia so that the research side can help to address some of those needs, whether it be through operational research, implementation research, or bench science, particularly when new diagnostics or treatments, for example, are needed. So how can academics and academia help accelerate the elimination agenda? I think there are a few ways that I think about this. One is through the operational challenges that countries are facing. So we have proven technologies that work, but when we actually implement them, there are bottlenecks and barriers that happen along the way. And so that's where the field of implementation research comes in, is working together with national programs, with PAHO, to understand what are those barriers and bottlenecks, and how do we together create the solutions that are needed to address them. So I think in a lot of the last mile areas where we need new innovative approaches, implementation research is going to be key towards helping to reach the goals in those areas. And then I would say, in terms of operational research agendas, new technologies, how to scale them and how they can be sustained, I think is also a really important area where research can help contribute and share findings from other places, other countries that could be relevant for member states and for PAHO. And then finally, in the bench sciences, and I know in Canada and I know in other countries in the world, I'm just more familiar with the Canadian context. There are scientists working on new treatments for leishmaniasis, for example, new diagnostic tools. And so collaborating directly with PAHO and sharing the outcomes of that research will be really important. So the importance of community-driven approaches, this is like what I've spent most of my career looking at. I think we can't reach our goals without involving communities better. And I think we are recognizing more and more the power that lies in community, and that we really can't implement top-down approaches anymore. We have to stimulate the community leaders, the organizations, the associations, who already have their structures and their respective leaders who can really help to support the elimination agenda. So I think reaching elimination without communities is not going to be possible. And I think that's certainly true as we reach the last mile of a lot of these diseases. In terms of innovations, I think there's a lot coming out of, for example, those working with Indigenous communities who've really maximized the structures within those communities to reach goals. And I think we can learn a lot across different Indigenous communities and sharing how things are done. I think also that applies in hard to reach communities as well, and understanding different innovative approaches that have been used to reach people that are outside of maybe our normal health system reach, and what we need to do to reach them. I think technology offers us new ways as well to reach people. Social media also brings new avenues of creating new communities for disease elimination as well.